Welcome to the Burn Aid channel. Thank you for joining us. Today, we'll discuss the critical steps to take when transporting a burn victim. Proper handling and transport can make a significant difference in the outcome for burn victims. Let's explore the key considerations and best practices for safely transporting someone who has suffered a burn injury. Initial assessment and stabilization. Before transporting a burn victim, it's essential to assess and stabilize them. 1. Ensure the burn victim is out of immediate danger, such as from fire or smoke. 2. Check the victim's airway, breathing, and circulation, ABCs, to ensure they are stable. 3. Cover the burn area with a clean, dry cloth to protect it from contamination. 4. Avoid applying creams, ointments, or ice to the burn, as these can cause further damage. Considerations for transporting burn victims. When preparing to transport a burn victim, keep the following in mind. 1. The victim's comfort and pain management are crucial. Administer pain relief if advised by a medical professional. 2. Keep the burn area elevated if possible, to reduce swelling and pain. 3. Ensure the victim is kept warm to prevent hypothermia, which can occur due to fluid loss from burns. 4. If possible, avoid transporting the victim in a private vehicle. Call emergency services for professional medical transport. Calling emergency services. In most cases, it is safer and more effective to call emergency services to transport a burn victim. 1. Emergency responders are trained to provide immediate care and stabilization en route to the hospital. 2. They have access to advanced medical equipment, such as oxygen and fluids, which can be critical for burn victims. 3. Provide clear and concise information about the victim's condition to the dispatcher. 4. Follow any instructions given by emergency personnel while waiting for their arrival. Transporting a burn victim by private vehicle. If emergency services are unavailable or delayed, you may need to transport the burn victim yourself. 1. Ensure the victim is lying down, if possible, to prevent further injury and reduce shock. 2. Secure the victim with a seat belt or other restraints to prevent movement during transport. 3. Keep the vehicle cool and well ventilated to avoid overheating the victim. 4. Drive carefully and avoid sudden movements or stops that could aggravate the victim's injuries. Special considerations for severe burns. For victims with severe burns, additional precautions are necessary. 1. Large burns covering significant portions of the body require immediate medical attention. Time is of the essence. 2. In cases of burns to the face, airway, or chest, ensure the victim's breathing is unobstructed and monitor closely. 3. Chemical burns may require specific decontamination before transport. Follow safety protocols to avoid spreading chemicals. 4. Electrical burns can cause internal injuries that are not immediately visible. Monitor the victim's condition carefully. Communication with medical facilities. Effective communication with medical facilities is vital when transporting a burn victim. 1. Contact the nearest hospital or burn center to inform them of the situation and estimated arrival time. 2. Provide detailed information about the burn's cause, the victim's condition, and any first aid given. 3. Follow any instructions provided by medical personnel, such as specific care instructions en route. 4. Upon arrival, ensure a smooth handover to the medical team, including passing on any relevant information. Post-transport care and support. After transporting a burn victim, Follow these steps to ensure ongoing care and support. 1. Stay with the victim until they are under the care of medical professionals. 2. Provide reassurance and emotional support to help alleviate their anxiety and fear. 3. Inform the victim's family or loved ones of the situation and the steps being taken. 4. If you have been exposed to any hazards during transport, seek medical attention for yourself as well. Importance of professional training. Knowing how to properly transport a burn victim can be life-saving. 1. Consider taking a first aid and CPR course to better prepare for emergency situations. 2. Familiarize yourself with the locations of nearby medical facilities and burn centers. 3. Keep emergency contact numbers and first aid supplies readily accessible. 4. Regularly review and practice your emergency response plan to ensure quick and effective action in a crisis. Important notice: this presentation is for informational purposes only. Always contact a medical expert for treatment. Download the BurnAid app for free from the Play Store or App Store for more detailed guidance on burn care and first aid.